The governor has said it is a goal to have in-person learning available to all students in the state by March 1st.
And understandably, parents, teachers, and students all happy to hear that, but they also have a lot of concerns. And today, experts from Mott Children's Hospital at the University of Michigan offered some guidance. Dr. Frank George has the highlights for us. Doc?
Yeah, Karen and Devin. So the discussion covered a wide range of topics, from trends in teenage depression during the pandemic to ways to help kids cope with the abnormal circumstances created by COVID. But the main topic of interest was the safety of returning to in-person learning.
At this point in time, we actually have really encouraging data that this is a safe move for schools to start returning to in-person education. Just recently, there have been several good studies that have come out that have shown that the rate of transmissions within schools is really, really low, often much lower than it is in just the general community.
That's Dr. Allison Tribble, an infectious disease physician at the University of Michigan's C.S. Mott Children's Hospital.
We're not seeing staff members getting infected, and we're finding that when we look at the type of risk factors that kids have who are infected, it's not the school exposure.
And although it is critical to get teachers vaccinated,
we've already shown that schools are safe for teachers even when they're not vaccinated. So that by itself does not need to be a goalpost for opening schools. But of course, we should be doing everything we can to protect those teachers. I think the bigger risk to teachers is other adults, and whether that's adults in the community, because you're still going to birthday parties or baby showers or whatever it be in the community, or other adults in your school. It's very important that staff maintain these precautions around each other. I think that's a bigger risk to the teachers than the kids themselves. All of this together, just is a constant reminder that we have to maintain very, very strong, mitigation practices in schools, not just one, but layers and layers of these safety practices.
And the bottom line is that current research does not find that schools are a primary driver of spread. Now, the entire hour-long live discussion is available online if you want to listen yourself, and we've posted a link to it on our website, clickondetroit.com. It's really a good discussion.
Yeah, it was, Doc. But talk about the insights into how these new variants might affect in-person education now.
Well, that was brought up. The thing is, at this point, we just don't have enough information. Thing is, as long as people continue to practice good mitigation habits like masking and distancing, we're hopeful that it should be manageable.
We are. All right, Doc.